November is National Family Caregivers Month, and it's really a time to just recognize the millions of Americans who provide the care and support for loved ones living with either chronic or serious health conditions. Joining us right now are Pam, and who is a mother and mother of two children with cystic fibrosis, as well as Dr. Paul Mohabir, a pulmonary critical care specialist. And really, we just want to discuss how caregivers can facilitate some real discussions among their care teams and how doctors can help facilitate that. Good morning, you two. Thanks for joining us here.
Good morning.
Good morning.
Pam, let me start with you as a caregiver. What does that mean to you personally, and what do you wish more people would know?
Well, thank you so much for having us. We are happy to be here on behalf of Vertex Pharmaceuticals to raise more awareness how important the caregiver role is as a parent, as part of the team. It's a very big role. It's a role that's pertinent to good care for anybody suffering with chronic illness. I have two children with cystic fibrosis, Trenton, who's 22, and Marlena, who is 18. And being part of their care team is, very important to helping teach them how to take care of themselves as they get older and older. When they were younger, they needed a lot of attention and a lot of help. And as they've aged through teenager to young adulthood, they have learned to take care of themselves. So that's a big role as a caregiver.
Yeah, what advice do you give other family members or parents who are seeing their children mature in age and go through the different phases of life?
Well, what's worked for us is to just, I've raised Trent and Marlena to be really transparent, to be comfortable asking questions to their doctors, for them to know what options are available to them, like treatment options, what decisions they can make for their longevity and for their futures.
Dr. Mohabir, from a provider's perspective, how can caregivers best partner with their healthcare teams to ensure that their loved ones are taken care of the best way possible?
Yeah, thank you for the question. If we just take one step back to understand the disease, cystic fibrosis is a rare disease. However, it's actually the most common inherited disease amongst Caucasians. Going back into the 1940s, the survival at that point was about 6 months, which was abysmal. If we fast forward to 2025, our median survival is in excess of 65 years of age. So a lot of things have improved overall, it's a really good feeling. But it's not only about the therapy, it's also about understanding the psychology, the patient, the families, the caregivers. What are they going through? So the best way to pair with us and partner with us is to start at home. Talk amongst yourself with the family, the caregivers. What's important? What are the needs? What's around the corner? CF is a very tight and very educated community. Reminder, they've been dealing with this since birth. So a lot of history to build on. The second important strategy, I believe, is to go to a reliable source. There's a website, which is everyday-cf.com. That way we can build on the foundation and the major questions that we have and give some insights to what's around the corner. And lastly, it's us and the team. Come to the clinic, come to the office. When I close that door, in the office room, we actually have a triad amongst the caregiver, the patient, and the clinical team. And this is a really good time to understand your disease, you understand where I'm at, and just globally, where is CF and how do we move forward? As a reminder, I see patients in clinic every 3 months for their entirety of their life. So this is a good time to ask the questions. And if nothing's answered or not everything is answered, we can pick it up the next time we see you.
And yeah, I mean, it really is a team effort to care for folks who are in need of all of that, pretty much throughout their life. And it sounds like things have progressed in the last number of decades, right? It sounds like it's positive movement. So that has got to be an encouraging conversation for those caregivers.
Oh, certainly positive, if evidenced by the survival we've talked about. But it's not just positive for the therapies, it's positive about the outlook and how we can move forward into the future. There's a better survival, there's a better understanding. We have more knowledge understanding the gene. So this is a great time to understand the disease, but we also have to understand the people that are taking care of these patients as well. And again, I can't overemphasize that it's a whole team that makes this work.
Well, as we recognize National Caregivers Month, Family Caregivers Month, what message would you like to put out there from both of your perspectives?
I'll start off with go to a knowledgeable and reputable source, such as everyday-cf.com. Start with there, and then in the room with the clinical team.
And Pam?
Just stay educated is my main point. Educated, transparent, and have some grace. You know, as a caregiver, you need to have some grace. It's a lot.
Absolutely. Grace for yourself, grace for everyone around you. All right. We appreciate your time, both of you. Thanks for joining us here on Live Impact News.